Could you spot a heart attack before it strikes? Many people think heart attacks always mean sudden chest collapse. The truth is often quieter, and knowing the signs can save a life. Today we'll walk through real warning signals, the science behind them, and simple steps you can take right now to respond and reduce risk. This episode is warm, expert, and empowering. We start with a relatable scene, a busy morning, a rushed commute, a person ignoring odd symptoms. Maybe that was you. Maybe it was a loved one. That small discomfort could be a whisper from the heart.
Relatable problem. Heart attacks can look different for different people. Men and women may feel symptoms in varied ways. Older adults and people with diabetes often experience subtler signs. Because symptoms can be mild or intermittent, many delay seeking help. Delay fuels danger. Our goal is to replace uncertainty with clear, calm knowledge. First, chest discomfort. The classic warning is pressure, squeezing, fullness, or pain in the center of the chest. It can last minutes, come and go, or feel like a heavy weight. That sensation often spreads to the neck, jaw, shoulders, or arms. But chest discomfort is only part of the picture. Second, shortness of breath. You might feel winded doing ordinary tasks or experience sudden difficulty breathing. This can occur with or without chest pain and may feel like you can't take a full breath. For many, shortness of breath is the first sign. Third, unexplained fatigue. Feeling drained after minimal activity or unusual tiredness that lasts days, especially in women, can signal heart distress. Fatigue that interferes with daily life deserves attention. Fourth, cold sweats and lightheadedness. Breaking out in a sweat for no clear reason, feeling faint or dizzy, or sudden nausea can accompany heart trouble. These symptoms can be mistaken for anxiety or digestive issues. Fifth, jaw, neck, or back pain. Discomfort in these areas, especially when combined with other symptoms, can indicate that the heart is under stress. Women often report pain in the upper abdomen or back rather than classic chest pain. Sixth, indigestion or heartburn-like sensations. A burning feeling, belching, or stomach discomfort that's new and persistent can in some cases be cardiac-related, not just gastrointestinal. Seventh, palpitations or a racing heart. Sudden, irregular, or forceful heartbeat sensations should never be ignored, especially when paired with other warning signs. Eighth, sudden confusion or difficulty speaking. A heart attack can reduce oxygen flow to the brain, leading to cognitive changes. If someone suddenly slurs words or seems disoriented, seek help immediately. Ninth, pain that comes on during rest or minimal exertion. Chest pain that appears while sitting or lying down, or that awakens you from sleep, can be serious and should prompt urgent evaluation. 10th, symptoms that improve with rest or nitroglycerin may still be cardiac. Temporary relief does not rule out danger. Heart-related pain can wax and wane. Now the science. A heart attack occurs when blood flow to part of the heart is blocked, often by a clot forming over a ruptured plaque in a coronary artery. When oxygen supply is cut off, heart muscle cells start to die. The sooner blood flow is restored, the better the outcome. That is why time matters. Arteries can be narrowed slowly by atherosclerosis or suddenly blocked. Risk factors like high blood pressure, high cholesterol, smoking, diabetes, obesity, a sedentary lifestyle, and family history increase the chance of plaque buildup and clot formation. Chronic stress and poor sleep also contribute. Understanding symptoms in women, older adults, and people with diabetes is crucial because they can present atypically. Women may experience more nausea, fatigue, and back or jaw pain. Diabetic neuropathy can dull chest pain, making other signs like breathlessness or weakness more prominent. Actionable advice. First, don't wait. If you suspect a heart attack, call emergency services immediately. Emergency responders can start life-saving treatments faster than a delayed hospital visit. Describe symptoms clearly and mention known risk factors. Second, chew aspirin if advised and if not allergic while waiting for help. Chewing one adult aspirin can slow clotting and has been associated with improved outcomes in some cases. Only take aspirin after speaking to a medical professional or following current medical guidance. Third, if you are trained and a person becomes unresponsive and not breathing normally, begin CPR and continue until help arrives. Hands-only CPR can double or triple survival rates when performed promptly. Fourth, reduce your personal risk. Stop smoking, manage blood pressure and cholesterol, control blood sugar, maintain a healthy weight, stay active, and prioritize sleep and stress reduction. Small, consistent changes compound into big benefits. Fifth, get regular checkups. Routine screenings identify and treat risk factors before they cause heart events. Ask your clinician about personalized targets for blood pressure, lipids, and glucose. Sixth, learn your family history. Knowing whether relatives had early heart disease can change screening and prevention strategies. Share this information with your healthcare team. Seventh, recognize emotional signs. Anxiety or sudden depressive symptoms can be linked to heart disease. Seek support and talk openly with a clinician about mood changes. Eighth, create a plan. Teach family members how to recognize signs and when to call emergency services. Keep a list of medications, allergies, and health conditions in an accessible place. Consider wearing medical ID if you have significant heart disease. Ninth, use technology wisely. Many smartwatches and devices can detect irregular heart rhythms and remind you to move, but they do not replace clinical evaluation. Share concerning data with your clinician. 10th, after a heart event, cardiac rehabilitation, lifestyle modification, medication adherence, and mental health support improve outcomes and quality of life. Recovery is a journey. You don't have to do it alone. Real-life stories help us remember. Jane, a 57-year-old teacher, ignored unusual fatigue and back pain for days. She assumed it was stress until she fainted at work. Quick action by a colleague saved her life. Mark, 48, dismissed indigestion after a heavy meal. His partner insisted he be seen, and emergency treatment prevented major heart damage. These stories show how awareness and prompt action change outcomes. Common myths. Myth 1. Heart attacks always mean dramatic chest clutching. False. Myth 2. If pain stops, danger has passed. False. Myth 3. Only older adults are at risk. False. People of any adult age with risk factors can experience heart attacks. How to talk to loved ones. Be calm and factual. Share warning signs and your plan. Encourage regular checkups and a heart-healthy lifestyle. Offer companionship for appointments and activity changes. Support works better than criticism. Practical daily tips. Eat a plant-forward diet rich in vegetables, fruits, whole grains, lean protein, and healthy fats. Aim for 150 minutes of moderate aerobic activity a week, plus strength training. Limit processed foods, added sugars, and excess salt. Prioritize sleep and stress reduction practices like gentle walking, breathing exercises, or time in nature. When to seek help. Sudden chest pressure, persistent shortness of breath, fainting, severe sweating, or sudden weakness are urgent signs. Don't drive yourself if you suspect a heart attack. Call emergency services. Resources, heart foundations, local clinics, and certified cardiac rehab programs offer education and support. Use reputable websites or consult your primary care clinician for personalized guidance. Final empowering note: knowledge is power. Recognizing warning signs and acting quickly significantly improves survival and recovery. You can be the person who notices, decides, and saves a life. If this helped, save and share to protect someone you love today.